Our founder, Janet Siegel, wouldn't take "we don't know" for an answer. Too many professionals had no idea how to help her and others. She tirelessly pursued the medical community, creating partnerships that became the basis for our organization. We give patients the information they need, ensuring they're no longer alone and a little less scared. We promote patient care and support, advocate for favorable policies, accelerate scientific discovery, and have become the best single source of information on pemphigus and pemphigoid. We're compassionate in care, tireless in service, and relentless in advocating. It takes almost a year on average to get a proper diagnosis so patients can begin a safe treatment protocol. That's too long. We champion efforts that increase physician awareness and work with drug companies to improve access to emerging treatments. We need funding to support genetic research to unlock the mystery of these diseases. We must increase education for doctors in training and in practice so patients get diagnosed sooner. And we need to strengthen our peer support programs by recruiting more coaches and giving them better training. We need funds to support all of these efforts. By leveraging our industry relationships and our patient base, we can identify sufficient numbers for clinical trials, making them more robust. Our doctors have started a biobank for scientific inquiry, and we host a registry of patient-provided clinical data that protects their privacy while offering significant opportunities to affect the landscape of these diseases. These tools can provide researchers with substantial data for investigation. Because the disease process is limited to desmoglein, a specific protein, it could be a model for understanding other autoimmune conditions as well. We employ a small staff and draw talent from our community whenever possible. Donor dollars make an immediate and lasting impact on programs and services. Initially, patients feel alone and helpless, unable to confide in friends and family. The foundation educates them and their caregivers, giving them hope. We advocate for our patients on the state, federal, and international stages. To that end, we partner with other ultra-orphan autoimmune groups to form coalitions and share information on research. We fill a gap in the healthcare industry and have a trajectory of success. Each year, the Foundation tracks the number of patients we help, physician referrals made, and first-hand feedback. Many are adamant that we've saved their lives, and most patients and caregivers have said that we make a real and tangible difference because knowing that there are others who understand and support you makes it easier to cope. Our award-winning newsletter reaches thousands of families and physicians each quarter. And for such a rare disease group, it is noteworthy that the majority of our patients who volunteer disease data for our registry want to donate tissue or blood to research. These aren't diseases solely of the elderly. From baby Jacob with bullous pemphigoid to David orphaned on the Nigerian streets because of his lesions, pemphigus and pemphigoid certainly affect children. Whether a person is a victim of the disease or challenged by loving someone who suffers, the costs are real. Affecting 1 in a million people globally, with higher numbers in Ashkenazi Jew and Mediterranean populations, lack of awareness can mean 10 to 12 months to diagnose, increasing suffering and mortality. And this isn't just a human issue. Pemphigus and pemphigoid affects pets, and the Foundation helps them as well. We collaborate with leaders in bullous disease research and treatment. Our scientific meetings have resulted in published papers establishing common disease terminology, standardizing a disease activity scoring system, and moving towards first-line treatment consensus, all greatly impacting patients and clinicians. The Foundation hosts an annual conference where many meet another patient for the first time, and where doctors, patients, and caregivers learn from each other. And inevitably, off in some corner, a small group gathers, hugging, laughing, and sometimes crying. We're not alone anymore. That's a major accomplishment above all others in an ultra-orphan disease community. It takes about 10 months and 5 different doctors for a pemphigus patient to get a correct diagnosis. That's almost a year of dangerous, painful suffering. The financial toll can be overwhelming, forcing some to go on disability. Families must choose between groceries and bandages. We need more options. So do researchers. Doctors work tirelessly to find sufficient patient numbers for clinical trials. We must continually leverage our relationships to make this possible. And it's especially tricky to keep patients engaged in this effort once they've stabilized and when we need them the most to help others continue the fight. Because researchers believe pemphigus could be a model for understanding other autoimmune conditions, we need funds to understand biological process at work. We want to educate doctors in training and practice, increase our understanding of the disease pathology, advocate more at national and international levels, and share our data and findings with the global medical community in new ways. We will expand our awareness program, sending trained speakers into medical classrooms to help students recognize the symptomology and sensitize doctors in training to the plight of those with chronic orphan conditions like pemphigus. In doing so, we'll continue changing the current diagnosis and treatment landscape. While a rare disease, just 2% of pemphigus patients reach out to us. Many find us too late to improve outcomes. And with such small numbers, scientific studies lack sufficient enrollment. Innovative treatments used off-label are often not covered by insurance companies because supporting studies are so small. Our largest gaps are awareness among patients, physicians, and insurance companies, and funding to expand our programs to those in need. Closing these gaps will reduce diagnostic times, add to our patient population, increase access to current and emerging treatments, and support the families affected by these diseases.